Hi everyone, welcome to another episode of the GCS Connect Leaders Series. This one is quite focused on the public sector. It's always been an area that GCS has worked within, but we've expanded heavily our team and our delivery system in the last 6 months. And there's some great leaders that we wanted to speak to, just so that our listeners and our subscribers can understand a bit more about the difference between the private sector and public sector, but also the universal challenges. So we're speaking to Sarah Longdon from Dorset Council today. She's going to take you through a lot of how they manage change and how they manage the different factions within the public sector to deliver fantastic results, particularly during the COVID period. Hope you enjoy it. I'm sure you will. Thank you very much.
Sarah, hi, how are you?
Hi, good, very well, thank you.
Fantastic, good to speak to you today. Just for our kind of listeners, we've got Sarah Longdon here with us today. She's the head of service planning at Public Health Dorset, this is really part of our public sector drive within GCS and the vision that we're kind of really building. Sarah's someone that was worked with some of our specialists over the past few years, and someone that we felt would be really interesting to get onto the Leader Series and to find out more about your particular sector, your particular area of expertise. But so Sarah's got 25 years of experience, both in the private and public sector, her role itself is really far-reaching within the areas that she works within. And we were just talking just there in the kind of preamble about she's been a very busy lady over the past few years, obviously with regards to COVID, which we'll dive into a bit more. But we're both a little disappointed, aren't we, Sarah, because we felt we're using this Riverside tool, and you've got a fantastic background, haven't you? But it shows off, I think, the beauty of Dorset, but we can't use it, can we? So.
No, it didn't come up. It took it off. So we've got some lovely scenes of the countryside and the coast in Dorset. One of the reasons that why I'm here, why I live here. So it's nice to have those to remind us of
Exactly.
Life outside of work.
But as it is, we're both in the office today. We're doing our bit to get the world working again.
Yes.
So I'm with my green background, you're with your white background. So really our video editing guys could probably, make this all look very nice in the background and put some flowers and London city scenes in the background, but we'll see whether he can work his magic. But Sarah, do you want to just, before we start, take us through a little bit more about your role, what you do, and maybe for some people kind of what public health is. Obviously some people work in the sector, but for those maybe listening in other countries or something like that, might not know how the public health part of the health service works.
Yeah, sure. So my role is head of service planning, which means I've got two main objectives. The strategic business planning for public health, so our core objectives, our work plan, our aims and objectives, working with our partners in health and care and local government. But also looking organisationally at our team and our service, making sure that we're aligned to deliver those objectives appropriately, looking at our structures, our workforce, our training programmes, recruitment, retention, all that kind of thing. So I've come into this role through my background as change and transformation lead in the last decade or so in local government, doing quite a wide range of big programmes, and before that doing similar change programmes in financial services. So quite a wide range, and I think one of the skills I give to my role and these programmes is it doesn't matter what the subject is. It's about core principles, planning and clarity to be able to deliver a good result. So a little bit different, and it's more organisational in public health, but there's a huge amount to do. Public health has been core and central to the response to COVID locally in communities, and working with all of the agencies in the public sector to combine and work together and deliver the responses, manage the guidance, and helping people through and providing information and communicating well, and particularly with the voluntary sector, communities, really making sure that people understand what needed to be done, and doing that well. And I think locally, most people will say that what they've received and what they've learnt through the response programs has been very well received, and we've built up some great relationships with our communities, in particular with people who work in the communities on a voluntary basis. You know, they are genuinely the unsung heroes of the COVID response. So, you know, hats off to them. And it's not over. You know, we continue to respond. Less COVID, but more cost of living is now the need.
Because that has an effect on health, doesn't it? You know, that has an effect on mental health, and you know, and as you're getting into these colder times, even with the caps and help that the government is giving, it's going to be a tough winter, right?
Absolutely. Yes, very worrying outlook, and the local authorities are, you know, at the heart of that as well. So I think if we can continue the principles and what we've learnt and how we've worked well together in local systems, that's absolutely what we need to do going forward.
So just, I mean, I think obviously the way I see your role, and correct me if I'm wrong, as a kind of leader is really to plan. You know what is coming down the line, and how are we best going to kind of use our resources to give the best level of service, right? I think I'm kind of right in saying that.
Yes, I think yes, that's absolutely right. There is so much that could be done, and we'd like to do. You know, people in our line of work absolutely committed, dedicated to providing solutions and providing good outcomes for the population as a whole. You know, it's and such broad objectives of public health, so reducing health inequalities and improving the health of the population. You know, you don't do that on your own. No single service does that. It's very far-reaching, wide-ranging, and very long-term as well. So, in terms of sort of program planning, it can be difficult to see direct results. You know, but you have to put things into place that can be sustained and can have some longevity.
Well, I guess that's one of the things you saw with COVID, was you were seeing the direct results. The question I had about COVID was, I guess, you know, in business as a leader, you know, quite often you're looking at a range of scenarios, aren't you? Like, what could happen and what would we do if this happened? So I've got a couple of questions for you kind of around the COVID side, because obviously, you know, if you're thinking about how are we going to allocate our resources during this, you know, unprecedented, you know, crisis, you know, I'm assuming that, you know, you were really on your, you were, wow, this is the most challenge I could probably receive, you know, in my career. But so a couple of questions to kind of take through the story, because I think it's really interesting as a leader as to how you dealt with it. So my first question is, did you predict, or did you plan for this to happen? Because this is worst case scenario, right? I guess like a pandemic is like, you know, excess death, etc. So did you kind of plan it out? What would we do if?
I think generally, I mean, I came into public health in the middle of the early days of the response. I think that was as a result of needing more capacity, more expertise in that planning and coordinating role. But public sector in general, you know, planning for these type of things is ongoing. It's not new. You know, pandemic and other disaster planning, continuity planning, you know, it's always there. It's always been there. And pandemic's just one scenario that each area's got its local resilience forum, which is multi-agency. It's often chaired by the police, but everyone's involved, and it's just putting into place structures and methods of coordinating responses to whatever comes up that needs public sector coordinated response.
It's quite kind of interesting, isn't it? Because when you think about that, you don't, as a citizen, you don't necessarily think this would happen if there was a terrorist incident or a bomb or
yes, exactly.
Or a pandemic.
And I think,
you don't really. It's good to know that somebody somewhere is thinking about what's going to happen, right?
Yes, I mean it's often more commonly in, for example, flood responses. Adverse weather conditions that affect the public in a big way, but it's often and terrorism, bombings, things like that, Salisbury poisonings, that's very well publicised. So, but it's
that's
often
unprecedented again. Could you have planned for that? I don't know. That's kind of, I guess,
It's I think a good disaster plan just covers multiple scenarios,
really?
And there are some core basics that just kick in, but I think what was different with COVID is how long it's been going on. Disaster planning is normally short term, and there's a definite end.
Or something,
there's a point at which you are sort of go into recovery and putting things back into place and getting back to normality. And it was so stop-start with COVID, and it's just so unpredictable that that's where it has been unprecedented, I think. It's still ongoing. What we're trying to do in our own public health service is get back to our own business as usual and get understanding what our priorities and the normal business of public health and getting that back into some kind of strategic plan. But everything's changed, and the partners we work with in health and care sector, we've got new integrated care systems which are just getting themselves up and running. So, everybody's got new priorities, and with all the with a lot of change in government as well, clear political and policy direction is I wouldn't say it's quite there yet, so the strategic planning is.
Well, when we release this, there might have been a new leader by now. So it's November the 2nd today. So who knows what will happen by November the 15th when this goes live.
Yes. I mean, during the pandemic, we had the change of Public Health England split into two new agencies, the Office for Health Inequalities and Disparities and UK Health Security Agency. So, that's in the middle of a long-term response. So, just an example of how it's all constantly changing.
Well, I think I speak again as a citizen to say that, and when we were talking about this before, I think that it was it's a credit to everyone that works within those types of organisations that we were kept safe, and it could have been a lot worse. So I think, as with all people, and you talk about unsung heroes, obviously a lot said about the nurses and different types of workers, but they maybe don't talk so much about the leaders, but also the kind of administrators and stuff behind kind of making sure the whole machine works, right, and working under quite difficult circumstances. So I think I always look in these kind of conversations as leadership. So I'm assuming, the way you've just described it, you were kind of brought in we need a head of service planning to kind of work out what we're going to do, and that's a kind of, I don't know if you've ever seen Pulp Fiction, like the bit of the wolf, when they bring Harvey Keitel in the Pulp Fiction. Now, obviously you might not know that reference, if anyone is listening might know that. But so when you came in, what were your steps, because I think it's really interesting for any leader listening, like this is a huge challenge. How did you deal with it, like day 1, day 5?
Yeah, I think it's, I wouldn't, to be fair to the public health professionals, the directors, consultants, our partners, they know what they need to do. Let's be clear about that. But it's providing that, like as you said, planning, that ability to the clarity, to seek the clarity, and articulate well how to get organised and monitor, plan, and deliver. And I would say basic core programme management capabilities. Just giving that extra capacity, that extra clarity, extra focus, and getting things organised, and then being able to communicate that well. So that was the kind of the urgent need. When you have multi-agency group coming together, just having a clear path as to what we need to do, and whose role is what. Because in this kind of situation where it is, it's so sudden, everyone's involved, but there can be some overlaps and fuzzy boundaries. So roles and responsibilities, basic stuff.
What are the key challenges you kind of come across in your role? But what were the key? I guess the challenges are intensified at that particular moment. What challenges do you face?
There is so much to be done. There are so many challenges. In the world of public health, improving the health of the population. It's huge. So we can't do everything. We'd love to, and we can't do it on our own. So for me, the challenge is to really work with the leadership team and our partners to be clear on what is the most important, what is achievable. And having a clear path of core objectives and key priorities, knowing that everything else is still there, and we will be addressed, but we need to just really focus on the most important and let everything else follow in line. And getting everyone to sign up to those priorities, because as I say, there's so much to do that we'd love to be able to do everything. So and it is system-wide work. Health inequality is something that everyone.
And is identifying those stakeholders also important? One of the things we do in sales sometimes is when we're putting together a solution, we need to kind of work out, need to speak to this person, need to speak to this person. Is identifying the key people that you need to bring along on the journey important?
It is. It's always important to know your stakeholders, who you need to work with, and what they need to do, what you need from them, and vice versa. I think the challenge that we have at the moment is there's so much change in the sector. I mentioned the new integrated care systems. They're only just coming up together. In Dorset, it's it's a whole new leadership team.
Sure.
So we're working with them very closely. What the worst thing you could have is each organisation having their own strategies that are contradictory. We need to harmonise and make sure everything aligns. Everyone's got their own particular focus and their own agenda, but we need to harmonise those and have some core shared objectives that we can work together.
Sure. You strike me as quite a calm person, Sarah. In your way, like we've had a few conversations now. Is that I assume that's again the kind of the persona that you put forward.
Yeah, I think that's me. That's my personality. That's who I am. And I think what I've learned is not to try and be somebody else. I think it's really important to be yourself and your own personal integrity. But I think it's important in my role as well. We've had some very, very difficult times. The public health team have been, long-term crisis management is very difficult, and you need to try and avoid that where possible. But being that sort of calm, organised person at the centre, helping, it's very, I see my role as very much supporting others. It's leadership, but it's supportive leadership. And it's making it easier for others to do what they need to do by providing that clarity, that direction, understanding issues, and maybe maybe being able to kind of show that clear path where where there's so much going on, it can be difficult to see where you're going and how to move out of crisis management or difficult situations.
And you've talked there about communication being obviously the key thing, in bringing these disparate kind of groups together and formulating a clear plan. Yeah, how do you go about that? How do you kind of plan that communication? How do you make sure that you're communicating clearly? Do you have certain things that you always do and little tricks?
Well, I think for me, my own role in this is communicating firstly within our own team.
Sure.
We're quite a big service of public health, bigger because we cover 2 local authority areas. We're quite a big team, and so for me, it's getting a very clear message together. Keep it very, very simple. Look, people sometimes think you need to explain everything, but that can be counterproductive. I think if you keep it simple and core messages, I sound like a textbook, I think.
It's good.
Keep it going, keep it going, keep the message, drip feed, and be available as well.
Sure.
Communicating isn't just about telling; it's about listening and responding. Right. So, everyone's got questions, and you might think, well, it's very simple. Why don't you understand this? But that's just, other people will see things and receive messages very, very differently. So you have to be able to give people time and the opportunity to say, well, I don't understand, or people won't tell you that they don't understand. You'll only find out later. So, you just have to be very aware and listen more than tell.
That's right. Yeah, I find it funny sometimes, and you can send emails, and then someone says, "Oh, did you? What's happened with this?" And I'm like, "I sent you this email. We spoke about it. I'm sure we spoke about it. I can remember the conversation."
Well, when you think how busy everybody is, there is so much to do, and it's you just have to assume that people won't pick up everything. Well, they don't. It's I think that's the work I'm doing at the moment in our own strategic planning is trying to distill down to the really important basics, get those right.
What the priorities are, and get those right. And I think that's
and
really key.
Work with the team to have time, particularly when people have been so overwhelmed with the response, and I think we will see long-term impacts on everybody, not just the people involved in the response, but the population as a whole in terms of sort of coming out of this. And I think, it's and our own workforce. I think what's important for me is that we allow people time to decompress, if you like.
Yeah.
You think, oh, COVID was last year, the year before. It wasn't. We're still responding. It's much more under the radar now.
People are still dying, aren't they? There's still many cases. It's just that I think it was funny, with the COVID thing. How worried we all were, and I'm sure you're still worried. But they told everyone to be really worried, and then there's a point where they said you don't need to be worried anymore. And I think part of that was a kind of thank God. But it's such a strange psychological thing, isn't it? You're now walking around and people aren't so aware of it, aren't thinking about it so much, about the kind of transfer, like you say, about public health, like transfer of diseases, the reason to wear face masks, etc., etc.
Yes.
And I think that's a cultural thing as well. But it's good to. And I just wanted to kind of link back into obviously we talked about your experience within the private sector as well as the public sector. And we've obviously spoken to a lot of leaders within the public sector, the private sector, not so much the public sector. But your key points there about clear communication and, basically making sure that you can kind of get down to some points and lead in that collaborative way are very similar to what we hear across all types of different types of industries. Do you think there's any key differences between kind of leadership within the private and the public sector that you've seen in your experience?
I think there's more similarities than differences. I think the core principles apply equally. And public sector isn't one thing. Public sector is vast, and different agencies and different areas of public sector have got their own characteristics and their own, focus. But I think the main difference for me in local government, which is probably similar to most public sector, is it's the political and democratic element. So, the political leadership, policies set by elected representatives does give a very different focus. The electoral cycle is very important in terms of planning, and also the public scrutiny of our work. You wouldn't see that in private sector. Quite rightly, we're funded through public funds, so we have to be fully accountable, demonstrate value for money, and that are quite rightly so. But what over the last 12 years or so, austerity, everyone's fully aware of the cuts in public sector funding, and that's not gone away and probably won't go away, is what we're hearing about what's about to be announced in the next financial statement. So that's ongoing, but demand increases. The need for providing the public services that we do through local government or healthcare or whatever is going up and is continuing to go up, but the funding to deliver those is continuing to go down. So
particularly with inflation and that sort of thing, even if it's raising, it's not raising as fast as costs.
So we have the absolute need to innovate and transform and be efficient and do things differently. But you don't have a bottomless pit of investment to do that. So it can be very contradictory to save money and be more efficient, but to innovate and transform at the same time.
And you talked about innovation there. One of the things that I was quite kind of interested in, and I know there's been, because we work within GCS, we work quite a lot with e-government and, NHS Digital, for instance, all these types of things. Do you see innovation as a key way of really dealing with, maybe more austerity and certainly increasing demand? And is that something you factor into your leadership yourself?
Yes, definitely. Particularly in how we work with our partners, in terms of sort of the working with the residents and service users. Public health services are less directly delivering directly to the residents, although there is some of that, but it's more population level initiatives. But everything, all of our work and how we work ourselves as an organisation. I think the digital transformations, technology, it's absolutely fundamental to moving forward, to evolving. And I think, there have been some great examples of innovation in public sector, in healthcare, as you say, with NHS Digital, government digital services. We should all be looking to apply those solutions and those advances as universally as possible. And the way, just generally, we live our lives, is changing so much. And you look at how our children interact and work and do things. That we should be making sure that just normal way of living, and that we can support that. I was just thinking before coming in to talk to you about how quickly things have changed. And just I went to buy my coffee this morning. Just use my phone. I don't take my credit card with me anymore. Right. And it wasn't that long ago that contactless came in, and before that, you put in. So it's some
I
of
used my watch
these.
the other day. I used my watch to FaceTime
Yeah,
the other day, and then
yeah,
someone was like, "Wow, that's really cool." I was like, "Oh,
yeah,
I keep forgetting that you can do it, so I don't even need my
yeah.
phone anymore."
Yeah.
You know.
So I think there's two things. There's some basic solutions that can have a universal application. We really should be doing as much as we can with that,
Sure.
and thinking creatively about there isn't one solution for everything, but there are some principles and some developments that we could probably do a lot more with. But equally, in our role as public sector and supporting our residents, and we need to very much concentrate on the people who maybe can't access those solutions. A lot of our effort, quite rightly, is supporting vulnerable people who maybe just aren't able to use digital or online services.
Yeah.
But that's where the cost and the effort is. So we absolutely
Yeah,
must shy away from that.
And another thing that I think is, like you just said, obviously the public sector is filled with many different organisations and people that work together. Obviously, one of the things that I feel in the private sector that's good, obviously, in the private sector is you're all focused on one thing generally, which is making profit. So therefore, everyone within the organisation is kind of working towards a kind of a key goal, if you know what I mean. And one of the things I was going to talk to that, so therefore you see quite a lot of collaboration across the organisation. You have people kind of working towards those types of things. How do you foster that within the public sector? How do you kind of concentrate the mind towards like one key goal, if you know what I mean?
Yeah, that's very difficult.
Okay.
I don't think there isn't one key goal.
Yeah.
Even within an organisation, most public sector organisations are huge. So local governments, hundreds of services within that, different areas. You've got the supporting adults, children and young people, place and environment. They've all got their own specific areas of focus. So you can't say that there's one goal, unless it's fundamentally, just delivering the best service that you can. I suppose, how we support communication interaction with our customers. You could say that's universal, and that's something that we're trying to do. Make as much improvement as we can with the customer service side of it.
Sure. So do you collaborate quite a lot with similar people in similar jobs in different public health organisations? Would you kind of share best practice, that sort of thing?
Yes, very much so. Yes. Across public sector organisations, in one area, and with our own colleagues nationally. There's a lot of best practice sharing, and we did a lot of that through the COVID response, and just keep that going. I mean, we did before anyway, but that's a very useful way of understanding what works and what people are doing.
So, Sarah, I mean, it's been a great conversation now. I'm really, really enjoyed kind of finding out all about, the fantastic work that you're doing. But obviously, it doesn't stop, right? So, what are your kind of key priorities for the year ahead? Hopefully coming out of COVID, but there's so much more to do, isn't there?
Absolutely, and I think it's that clarity of our strategic aims over the next year or so with the new integrated care system and the integrated care partnership strategy, which is fundamentally involved in that and leading on that. And we need to make sure that our own work and our ongoing programmes and activities align with that, so that what we're doing complements and supports what the system is doing and vice versa. And therefore, in making that clarification that our team are aligned to that work and can see that they are doing the right thing for the right reasons. And I think that really helps with people's motivation and energies to be able to see the link between the big picture and individual work.
Fantastic. It sounds like you've got a lot on your plate kind of going forward. And I think, again, I'd like to say kind of thank you very much for joining us today. I think it's been really interesting just to kind of hear about, those, how you've implemented the services and really, obviously helped us all in the last few years, but continues to help us kind of going forward, Sarah. But thank you very much for your time today.
Thank you.